Hi, I'm Katie Huffling, and I'm the Executive Director for the Alliance of Nurses for Healthy Environments. I'm also a nurse midwife, and I'm joined by Kara Cook.
Hi, I'm Kara Cook. I'm the Director of Programs for the Alliance of Nurses for Healthy Environments. I'm also a public health nurse. Our work with the CCHE initiative has mainly been through our Environmental Health Nurse Fellowship Program, which the fellowship program was a year-long program focused on training nurses in partnership with communities to address environmental health issues and climate-related issues within communities, with the overall goal of advancing climate resilience and climate and health equity. In addition to that community level work, those participating in the fellowship program also did activities to increase awareness with their health professional colleagues to overall help enhance the health community's knowledge and action at that intersection of climate, health, and equity.
And also, we are really excited to be just about to launch our Health Equity and Anti-Racism Leadership Institute. We had over 250 nurses apply for 70 spaces in this 6-month learning opportunity. And what we're hoping from this institute is that through the lens of health equity and anti-racism, nurses will be working within their healthcare institutions and within their communities to address environmental injustices and health inequities, and really start developing authentic relationships with their communities around partnerships with nurses and healthcare institutions to address the systemic racism, both within our healthcare institutions and communities, from that health equity and environmental justice lens. So we are really excited to be starting that soon. One of the things that really inspires me about this work, we were just wrapping up that first cohort of the Environmental Health Nurse Fellows as the pandemic hit. And all of us at Annie were like, are we going to be able to keep this going? Are nurses going to have the capacity to continue with this work? And it was so amazing. I mean, the Annie nurse community just really coalesced during the pandemic. We've had more nurses engaging with us than ever before. And, they just have talked about how the community that we've built together has been so important during the pandemic, and to have other activities to think about besides COVID 24/7. So it's just been really enheartening for us to have so many nurses and especially new nurses working on these important environmental health issues with us.
I think for me, one of the pieces that really keeps me inspired is that, like Katie was saying, we're at this intersection of climate, health, and equity. We're seeing, a lot of movement in that right direction and movement that is really positive. And so we're hoping to continue to build on that in our work with the CCHE initiative, and hopefully be able to launch a second cohort of the fellowship. I think, it was just truly inspiring to see all the work that came out from our first cohort, even though it got a little derailed by the pandemic. The work, the relationship building, and the positive impact that we saw in communities was just truly inspiring. And we had nurses, engaging in a variety of activities, working to launch campaigns and partnerships with communities, working to amplify advocacy efforts and leveraging the nursing voice to really emphasize the health impacts of things like dirty energy infrastructure in communities, or emphasizing the health benefits of transitioning to clean renewable energy, or the health benefits of climate solutions, and really kind of, putting the community at the front and center of that, and helping to uplift the community level solutions. So that was just really, really great to see. And so with, continuation of this fellowship program, we're only hoping to continue to expand on the community impact of the program, to expand the partnerships that nurses are able to engage in, and as well as to really deepen the positive impact in communities.